Hey everyone, this is Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and I'm here for another installment of Sketches to Surgery. We're going to continue our discussion today about gynecomastia, or male breast and breast treatment. If you like this video, please hit like or subscribe and share this video. There's someone out there, including yourself, that may benefit from this. So thanks for tuning in. Here we go. In our last two videos, we talked about what gynecomastia is, what are the causes, and we touched on type 1 and 2. Today we're going to focus on type 3. Whoa, okay. Type 3. So that's what we're going to focus on today, and so let's talk about that. So what is type 3? So gynecomastia is a continuum, as you can see. It's a continuum of more breast tissue, more skin, more breast tissue, more fat, more skin. So we're at type 3, which basically means, and as I lean back, here are your issues. You've got increased gland, increased fat, and increased skin. And again, this is a gradation, especially when you're talking about the skin. So if you have skin that is lax, but as the plastic surgeon, you feel that it is not excess or to an excess that you may need to remove it, then this is typically what I call a class 3 gynecomastia. It has the increased gland, increased fat, and a modest amount of increased skin. So how does one treat this? So again, let's back up and refocus, and let's go here, and I'm going to try to zoom in. If it's too much, I'll zoom right back out. So here we go. So I'll move over, perfect. So on a side view or 3/4 view is where you really see the true nature of this issue. On a frontal view, you probably won't be able to really appreciate it. So on the side view, we have, as you can see, and I'm going to draw here, I'm just going to draw a dotted line, which would be kind of the breast crease, for lack of a better term, or the division between the chest and the abdomen. As you can see here, I've illustrated kind of a rounded breast that looks more like a female breast, but not quite. It's above the breast crease, so there's not a ton of excess skin that gives you kind of a droopy chest. So it's just a fullness, and that fullness creates some excess skin. Obviously, you have the components that I talked about. You have the skin, you have fat, and I'm just draw some fat circles. You get the picture. And then you have, I'm going to reach, you have excess gland that gives you a little proudness to the nipple areolar area. So how does one treat that? You really can focus on, and I'm going to erase this as my, you really focus on a couple of things, in my opinion, and I'll just write treatment. I think a core component is liposuction. And liposuction obviously will take care of the fat. So liposuction of this area, and I think liposuction of this area and beneath are very helpful to shape the chest, really try to empty that area from, and I'm going to draw this This is the muscle. Really try to empty this area for sure, and try to bring down some of the fullness on top of the muscle, but really empty the area below the muscle, side of the chest wall, and as the chest contours or transitions into the abdomen. I think that's really, really important. So you can use traditional liposuction, and I'm going to call traditional liposuction tumescent. And that is just a fancy word for filling these areas with a fluid that contains novocaine or lidocaine and adrenaline or epinephrine. And that allows for control of discomfort and control of bleeding. Now, you can then use a couple of types of liposuction, but it basically boils down to removal of the fat. You can use power assisted liposuction, which the cannula or the metal tubing vibrates, and then the surgeon just kind of moves like playing a violin, but the cannula is vibrating. It reduces the fatigue of the surgeon and allows the surgeon to, work a little bit harder and more diligently toward achieving your results. You can use Vaser liposuction, and this may be helpful for someone who's already had this done, where you have a lot of scar tissue, or you have some excess skin that you don't want to cut out or remove, but you want to shrink. Liposuction will help some shrinkage. Vaser, because it delivers energy to the skin, will help that skin potentially contract. So Vaser can be very important. You can use one or the other or both, doesn't matter. I stick to predominantly power assisted liposuction. I'm able to get the contours I want, but if I really was on the fence about the excess skin and I wanted to add Vaser as a component of the liposuction, again, Vaser is just delivering energy, it's not the liposuction removal, and then I would add that energy to help that skin shrink back. So we definitely want to do that. So that takes care of the fat in the skin without incisions that are large. But we still have to take care of the gland. So how do you do that? I call this a little bit of, obviously, we're going to take care of the gland. So it's kind of basically a small sub-Q, and I'll abbreviate this, mastectomy. So basically, draw the areolar, draw the nipple, and then what I like to do is early on make an incision in the areolar. That incision can be used as an access point for liposuction of the chest, upper, lower, lateral chest, and down toward the crease, but it also you use to remove the gland that is beneath the areolar and nipple that gives it that puffiness, so that we can flatten and really get that nipple and areolar to stick down to that empty space below the pec muscle. So I definitely would do that and add that as a component to all my gynecomastic surgery. So that's how I would treat a type 3 gynecomastia. Basically, and I'm going to zoom in here and I'll zoom back out again if it's too much. And I'll lean in. So we said lipo and gland removal, and typically the incision is in the areolar, so I'll just kind of dot there, and then I like to make one kind of in the axillary fold. Occasionally I might do one here, but really here and here, so that we can lipo these areas and I can remove the gland. simply put some simple stitches or sutures to close these areas up. I like to use dissolvable stitches here. I may use a stitch here that I would need to take out in about 10 days or so. And then we go basically with compression. And that's in the form of a garment or kind of like an Under Armour t-shirt, but medical grade compression. So medical grade compression. And I usually like to do that, and I'll back out, for about 6 weeks. After 6 weeks, in my opinion, compressive therapy has limited medical benefit. It can help if the client is starting to exercise more vigorously and to control swelling after exercise. But as far as really controlling swelling significantly and aiding shaping somewhat after 6 weeks, there's really not a lot of benefit to medical grade compression. I do ask my clients to transition at this 6-week period to non-medical grade, and I'll put non-med grade compression. And that can be a form of Under Armour shirt or some tight supportive comfort wear. So, and they can do that as long as they feel comfortable. So again, this is my discussion of type 3 gynecomastia. I hope this is helpful. If you missed my episodes prior to this, I encourage you to go back and look at the series. And the next time we will obviously talk about type 4, which is a totally different treatment than 1, 2, and 3. So if you like this video, please like or subscribe. If you have comments, please leave comments below. And if you think this is helpful not only to you, but to someone else, or just helpful to someone else, please share. Follow me on Facebook at the Modern Gents Society. And if you like to join my private men's Facebook community, you can join that as well. The name of that group or community is the Modern Gentleman Society. So until next time, guys, we'll see you soon.